After you've had a toxin injection, we do ask you to return to clinic or let us know how you are 2 weeks later. The reason being is that this is that magic window where if we need to add any more to make your treatment as good as it possibly can be, this is the time we need to add it. So by 2 weeks you get your maximum effect, and between 2 and 3 weeks, if anything needs tweaking or if you need any additional, this is all actually part of the cost of your treatment. So we always invite you to book a follow-up appointment 2 to 3 weeks after your initial toxin injection, so that we're able to have a little look and see if you still need any more injections. Now, some patients may find that they have zero movement whatsoever at 2 weeks, and then by all means you can cancel your appointment. Other patients may be a little bit uncertain, especially if it's the first time you've had it done. So I always encourage you to come back to clinic. However, if you live further afield or you feel like you're almost sure you don't need anything else doing, then I can always say that you can email me and take a little video selfie of you frowning, raising your eyebrows, for example, and then I can advise you whether I think it's worth you popping down. After that 3-week window, we then don't actually give you any more toxin until 12 weeks. The toxin will stay in your system for up to 3 months. So at 12 weeks it will be gone, and it's at this point that you can then have your treatment again. Some patients may think, well, at 8 weeks I'm noticing that my lines coming back, I'm able to move again, I want my toxin now. The reason we don't do it again that early is because there have been some studies that have suggested that you can build up antibodies to the toxin if you have it too frequently. And this means for you that it will stop being as effective as you get older. So you may get to your 60s, 70s and find that actually it just no longer works. And that's because you may have built up those antibodies. So we strive really hard to stick to that rule, that between 2 to 3 weeks is when we add any additional units that you may need. After that, we then don't add any more toxin injections until your 3 months is up. Hope that makes sense.